Mark, I believe you are flying south for the winter. What we wanted to do was show your chiropractor what we've been doing here, and then she can be up to date on how things have been working for you and so on. One of the things is we know that there's stenosis in the neck, narrowing of the canal, there's pressure on the spinal cord, pressure on the nerves coming out, a lot of degenerative changes, and the orthopedic surgeon had said do not do any kind of chiropractic adjustments to the neck. Am I correct?
Correct.
And so, but we still wanted to loosen things up because we have misalignments, we have tension. So for example, C2 is rotated left. When we took an x-ray, we saw that it was rotated left, which means it's front on the right and posterior on the left. And so what we want to do is kind of help guide that into place without major manipulation. So the way I do this is I kind of hold C2 and I pull it back and I have you turn your head to the left and come back, and you feel a stretch right in that area. Am I correct?
Correct.
Sometimes it's a bit painful too, right?
Yeah.
All right, do that one more time. Good, and come back. Good. Now your scalenes are guarding. So the scalenus muscles, there's 3 of them on each side. They're extremely tight, especially the right one, because you can tell when I push on the left, it's not as tender, but this one's extremely tender. So we want to loosen these up. But before we do that, we're going to do a couple on the left first. So this is a stretch, like active release. So you turn to the right and you come back to center. One more time, turn all the way and come back to center. Nice job. Then we're going to do this side. Now that wasn't too tender, right?
No.
Yeah, these will be. So we're going to come anterior to the anterior scalene, and we're going to press and hold. You can already feel tenderness, right? Go ahead and turn to the left as far as you can and then go further. Come back to center. Nice job. Again, turn left all the way and come back to center. That's already fantastic. Great range of motion. One last one at the very bottom. Come back. Am I correct that the first one was the most painful one?
Yes.
Yeah, it loosened up very nicely as we did that, and that's really working well. Now I can press harder and it's not nearly as tender as before. The other thing we want to do is, because flexion opens the canal, extension narrows the canal in the cervical spine. Lumbar spine's opposite. So what we do is I'm going to put 2 thumbs right here. If you want to bring the camera back this way, so I'm going to press right here, and all we do is just kind of stretch up, and you pull your chin down. Good. And we stretch up the neck like this, and that should actually, it allows for a gentle traction of the neck, but it also releases all the muscles, especially the suboccipital muscles. And it's also flexing the neck to open up that canal a little bit. That's not too painful, right?
No.
That actually feels good when we do that?
It does.
Perfect, good. So now the upper traps are tight. Everything we do, I want participation with our patient here. So what I'm going to do is find some of those trigger points, like that's a tender spot right there. What you're going to do is you're going to bring this arm up as high as you like and go back down as I hold that. And you can feel tenderness when you come up, right? When you come up to the top. Right there, it starts to hurt. Good. Go back down. We're going to do 3 more of those. Good. 1. You're doing great. 2. Last 1 and 3. Great job, Mark. Very nice. You rest that. That's loose. The other one is right there. So go ahead and do this one 5 times. 1. Hang on, I slipped off. There we go. Go ahead. 2. 3 more. 3. 4. Last 1. And 5. And the reason I have Mark do it himself is because I don't want to damage the shoulder joint by lifting up too high, but he's going to push himself harder than I would push it anyways, because he's coming all the way back. And if your camera was in the front, you could see him grimacing, because it is painful when you bring that arm up. The nice thing is these muscles loosen up beautifully just by doing that. So next we're going to go face down. We have a pelvic distortion where we have PI ilium on the left and AS on the right. So we'll address that right now. Left side, PSIS. We're going to use drop. No side posture, and that's because of what we saw in the MRI of the lumbar spine. We want to be gentle with everything. So this goes up and to the left. Good. A little lighter. Up and left. Good. No pain with that, correct? 1 more. Good. And then this side, down and to the right. And this we can be a little more firm with. Sometimes I'll reach in the front and just lift up a little bit. You can always use SOT blocks as well to prop up that front or or on the left as well. So now when it comes to the low back, at L5, we have disc degeneration and mild spinal canal stenosis. At L4, right above it, we have mild to moderate intervertebral foramen stenosis on both sides. Then L3 has a grade 1 retrolisthesis and degenerative changes. And then we have a kyphotic upper lumbar spine. So with all of that going on, we don't want to do a lot of rotation and we want to open things up. So what I do is I'll take S1 on a very light drop, and we'll do 3 P to A's at S1, real gentle. It has to be really light, so we don't want to push hard at all. 3 small pushes, 1, 2, 3, no pain with that, correct? Good. Now we're going to take L5 spinous process, and we shift it up and do really light drops. So I'm pushing I to S, inferior to superior. That's to open up that L5, and then we're gonna do the same thing at L4. Then L3 spinous, we go straight P to A very gently. So this is S1, L5, this is L4 right here. We're gonna use the upper part of the drop. Let's lighten this a bit, nice and gentle. 5 and 4 right here. So again, just the tip of my thumbs, and that didn't drop, so hang on. We're gonna lighten it a little more. Here we go, 1, 2, 3. Then we said L3 has the retrolisthesis, and we don't want to really adjust too much there. He does have tenderness right there, right? Am I correct? Less on this side. So what we're gonna do is just kind of release those QL muscles. So I'm gonna press in like this. I want you to press your feet together. Keep pushing them together, and as you take a deep breath, as you start to exhale, relax your legs. Perfect. So this is kind of a reciprocal inhibition where we contract the adductors. It should release the QLs. So we're gonna do that again. Press your feet together as hard as you can. Deep breath, exhale and relax. Good, and every time you exhale, I push just a little harder. That's not too rough? Good, it should actually be less tender now. Perfect. So with L3, it just doesn't look stable enough to do too much adjustments, but L1 and L2, we can do some extension adjustments. And then we like to flip over and do some stretches that will improve the golf game. I assume you're gonna be playing a lot of golf in Florida. And L1. Perfect, that looks good. Just checking to see the mobilization of the ribs and the thoracic spine. Very gentle again, everything's nice and gentle. So turn over on your back. We always want to flex the neck when you're on your back just because of that stenosis at the mid-neck. And we want to do some stretches. So if we just wanted to improve the golf game, because you are right-handed, we would only stretch the right hip flexor and quadricep and the left piriformis to allow for that proper rotation. But we've been doing that, now we want to do both sides. So I'm actually going to stretch both sides. So we'll start with this up and across in a figure 4 position. And you should feel the stretch right back here. Good. And gently push toward me and hold. And relax. Perfect. Now don't push any further. I just hold it. As it relaxes, it automatically goes a little further, but I don't force it. Push again. And relax. Fantastic. You can feel it going further, right? Very nice. It's not too much of a stretch. Final push. Go ahead. And relax. Fantastic. So now, I want you to hold on to this knee with your hands. Let's raise the table up. Good. You already know the foot drops. So bring the table up just a bit. And you can bring the camera just a little bit over so you can see this. So I'm gonna hold this knee here. I'm gonna hold this knee here. With my leg, I'm gonna gently flex the knee. He'll tell me if it's too much. You can already feel the stretch, right? Is this too much? Just right? Or do you wanna go further?
It's okay.
All right. So push out like you're trying to straighten the knee. And relax. Doing okay? Push. Hold it, keep pushing, hold. And relax. Hang in there. One last one. Push and relax. That last one I may have gone a little too far because when you relaxed, it stayed there. So you okay right now?
Yeah, it's the knee.
Got it. Yeah. Yeah, we definitely don't want to push that knee too far, but that's why we'll do it this way. Holding this up tilts your pelvis up, allows the whole hip flexor and quad to stretch better. Bring this foot up on the table, and we'll do the same thing on the other side. And with this one too, we need to watch the knee. So I'll press here. Do you feel a stretch? Good. Hold, 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 and relax. Great job, Mark. One more press, or two more. And relax. Good. Hanging in there. Last one, press and hold. Good, and relax all the way. Great job. Perfect. Hug the knee and hold on to it. This one falls. And feel the stretch right now?
Big time.
Perfect. And push gently. And relax. Still okay? Push, push and hold, hold, hold. Now relax. It's not too much? Getting there. Push, one last one. Keep pushing, hold it, and relax, and we won't go any further. We'll keep it right here. Fantastic. All right, brother. Stand and see what you think.
Good job.
Thank you. Brand new and perfect.
All right, great.
All right. Well, we'll see you in Florida.
Yeah, thank you.